palate today. So to start off with some keywords, cleft palate and lip are the condition itself. Nasal cleft is when the cleft impacts the nasal passages. Genetics of cleft palate, palatoplasty is the surgery to address the cleft palate, and
so what is cleft lip and palate? If you touch your tongue to the top, to the roof of your mouth, that's your palate. And oftentimes in these children, this is not properly formed. So this often occurs with another condition that's called cleft lip. And this occurs because both are conditions that occur because of failure of proper construction of your muscles and the skin. And this is treated with surgery for function and aesthetic purposes and occurs in 1 in 1,000 live births. And this is more common in Asians and less common in African Americans.
So some challenges associated with cleft palate include both psychosocial and functional challenges. Things like social stigma, lower education and employment rates, and lower rates of marriage stem from the physical and aesthetic aspects of the condition, and functional challenges like difficulty in speech and feeding are the functional aspects of the condition.
So unfortunately, the road to recovery and to look a little more like normal is very long and arduous on both the parents and the infant involved, since this often occurs, this is diagnosed in utero. So this is something the child has to go through until their adulthood.
So just quickly, looking at the pre-op evaluation, they evaluate several things like eating and waking, broader syndromes that cleft palate might be a part of that might introduce further symptoms, infection prevention, just assessing risk before surgery, and problems with the inner ear fluid.
So as I said before, this condition is diagnosed prenatally, which just means that it's in the womb. So diagnosis is often done through ultrasound and is identified as early as 16 weeks. And sometimes MRI may be used for further clarification. And if you see, there we go. All right. So if you see, you can see a normal cleft over here because it's a bridge. There's a bridge between the nasal passage and your mouth. And then over here, there's a little opening. That's what cleft palate is.
So once the child is born, liptaping and nasal alveolar molding, or NAM, occur. Liptaping is a technique used to improve the alignment of lip and gums using adhesive tape to close the gap, make it closer together so that surgery is ultimately easier and has a better outcome. And NAM is kind of similar. It's also a non-surgical technique to reshape the gum, lips, and nasal structures. It involves a custom fit appliance similar to a retainer for orthodontic purposes, and it helps to guide the facial tissues into the desired position to make the overall final outcome for surgery better.
So next, at 3 to 4 months old, is lip adhesion and lip repair. And lip adhesion is a surgical process used as an early step in cleft lip repair, which just basically is a facial reconstruction. And then lip repair is used to correct separation in the lip and reshape the nose. It's a more cosmetic surgery. And as you can see with this cute little baby, you can see that it almost completely fixes the cleft lip.
So at 1 year is when the palate repair takes place, so after the lip repair is the palate repair. This is a surgical procedure to close the opening in the palate or the roof of the mouth caused by the cleft. And this aims to reconstruct the palate to improve speech, feeding, eating, and prevent nasal leaking. The overall goal is to close the opening and restore the muscles in the soft palate in the back of the throat.
So building off of that is speech therapy, because oftentimes kids with cleft palate have trouble pushing air through their palate. So speech therapy focuses on correcting speech sound skills and establishing correct articulation. And then there's also velopharyngeal insufficiency surgery, or called VPI. And this actually portrayed over here. As you can see, it aims to improve speech by fixing the inability of the soft palate to close off during speech.
Okay, so between 6 and 9 years is orthodontic treatment and bone grafting. So orthodontic treatment is treatment of the mouth and the teeth, and it involves surgery, bracing, braces, and other things, which aims to address the effects of cleft palate on the teeth and jaw. And bone grafting is a surgical procedure that repairs the cleft that affects the upper gum ridge using bone taken from the patient's hip. And this stabilizes the maxillary arch and improves the support of the nose base.
And then you have from 16 to 18 years is orthognathic surgery, which aims to correct the jaw because it's often not correctly formed. And as you can see over there, this part of the jaw is protruding and this one is a little inward. And then this surgery basically pulls this forward in order to have more alignment of the jaws. And as you can see, it's not completely corrected, but it's enough so it's not as noticeable.
So for prognosis and long-term outcomes, overall the prognosis is very good. With appropriate care from family, physicians, and others, individuals with cleft lip can lead a very healthy and fulfilling life, and the surgeries are curative both aesthetically and functionally. There are some long-term outcomes of the condition, including dental problems, similar to the orthodontic mentioned earlier, feeding problems because of the difference in shape of the cleft, and hearing loss due to the ear fluid issues.
Future research. There's a lot of genetic research going on because cleft palate doesn't exactly have a known cause. And it seems that it can be autosomal recessive, which just means that it's caused by a recessive allele. And then we have 3D printing and computer-aided design, which actually helps with orthodontic appliances. And then we have disruption osteogenesis, which basically fixes skeletal muscles. And then also with genetic research, they're coming up with molecular and cellular therapies, which help aid in cleft palate. And then there's minimally invasive surgery also, which pretty much just makes a smaller incision and just makes sure that it's not as invasive.
Great job.